So in today's webinar, we're going to have a conversation around co-production in data research. And before I introduce the panel and go into our discussion, I'd like to briefly introduce co-production using very much a textbook definition and where it sits in the wider context of public involvement. In case I know quite a few of you are public involvement and engagement professionals, but just in case you've never heard this term before or perhaps seen it overused, you may be confused about what it is, and I don't blame you. I still find myself getting confused over different terms and definitions used in public involvement, so I thought it'd be worth giving a definition on co-production now. And our speakers today will be able to add more to this, so I won't go into too much detail. But at its simplest, it's a collaborative approach to working with the public in research. There's no one way to do it, there's no one size fits all. But at its core, it's about the public, researchers, and or organizations working together with a shared responsibility in a project. So decision-making responsibilities are shared with the public, decisions not purely lie with the research team or organization. Everyone is recognized as having equal importance in the project. Like I said, it's a very basic textbook definition, and our goal today isn't just to talk to you about what co-production is. There's plenty of guidance and resources out there on this, which you can explore further. Um, so what we'll largely be exploring today is what co-production looks like in practice, and within the context of data research. We'll hear from a panel about what's worked well, what's been tricky, and most importantly, the lessons our panelists would like to pass on to others who are thinking about using co-production approach in their own work. So now I'd like to introduce our wonderful panelists today. So to start off with, we have Jack Palmer, who's been working as a co-production officer in health data research Wales. He works in partnership with a wide range of stakeholders, such as service users, charities, local government, and policymakers, to more effectively involve the people research is about in co-developing and co-delivering projects and evaluations. He promotes community-led prioritization and recently was awarded funding for a project called Domestic Abuse Survivors. Um, so this is exploring perceptions of public good and harm in the use of administrative data sets for public health research, he'll be working with underserved groups to explore survivors' views and concerns in this context. We are also joined by Dr. Michaela James, who is a researcher with a background in public health and youth engagement, specializing in play and physical activity. Her work focuses on co-production, citizen science, and amplifying young people's voices in shaping the spaces and policies that affect them. She leads projects such as Happen, which explores the health and well-being of young people across Wales to empower schools to make changes in line with their pupils' wants and needs. And she also leads another project called Our Place, which aims to understand how young people define and experience their local environments. Next up, we have Georgina Ferguson Glover, who is an experienced member of the public who has had input in over 50 health and social care research projects. She works with Genomics Partnership Wales in conjunction with the NHS and Welsh Government to improve healthcare. She uses her own lived experiences to focus particularly on improving accessibility in research and making projects as inclusive as possible. She is a big proponent of co-production and getting patients and the public involved from the start of a project through to the end. And finally, we also have Dr. Kancha Norendes, who is a postdoctoral research fellow at Administrative Data Research Centre, Northern Ireland, and she is involved in co-production projects with individuals with lived experience of homelessness and care experienced young people. Akanksha is currently developing a practical handbook on co-production for data-driven researchers, and she is passionate about science communication and making research accessible to wider audiences. So thank you all for joining me today. It's great to have you all here, and I'm looking forward to learning more from you. So I won't take up too much more time, so let's get into it. And first, we're going to kick off with a question for you all. So I gave a very short textbook definition of co-production, but I'd like to know to you, what does co-production in data research look like in 3 words? It's a difficult question. So I'm going to start off with Akansha.
Great, thanks, Katie. Co-production for me in 3 words would be collaborative, empowering, and pizza, because good food is really important in co-production.
Love that. Yeah, definitely. Food is very important in any public involvement meeting. Next up, we got Michaela.
I'm going to go with advocacy, autonomy, and agency as my three words.
Oh, love it. Thank you, Michaela. And Georgina.
So I've got collaborative, continuous, and equal would be my three.
Love it. Thanks, Georgina. And Jack.
And for me, I think co-production is purposeful, flexible, and reiterative. So not one off.
Love it. Very powerful responses. So now I'd like to delve a bit more into your experiences. So Michaela, your work is very much focused on co-production. So I'm interested to hear a bit more about how you first got started in it. Um, what did the start of your co-production journey look like?
So, if I'm completely honest, I fell into co-production. I was doing co-production before I think it had like an official buzzword in research. So when I joined academia back in 2017, I was leading a project with children and young people around empowering young people to be more physically active in their local communities. And part of that project was that young people got to shape and design what that physical activity looked like. And the whole intervention was based around, well, what activities can we provide for young people? And not positioning ourselves as experts in that, but actually saying that young people are the experts in their choices and having autonomy over those decisions. So we were running this research project, and it wasn't until I think about 12 months later when we were writing up the findings that we realised what we had been doing was co-production, and that actually this has been kind of like a theme that we had just approached with. And I'll be honest, it was from that moment of being able to like share that power and hand it over and having that light bulb moment of, you know, as adults, we often place ourselves as the experts just purely based off age, where I had this light bulb moment of being like, we actually know nothing and being able to hand that power over to people that are the experts of their lived experiences, people that are experts of their realities, you know, how they're shaping their lives. So yeah, the honest answer is I fell into it purely by accident, and it turns out I was just doing it organically, and it was never something that I sought out. But now it's a very strong ethos within all of my work. So, yeah, falling into it sometimes is the best is the best approach, really.
Yeah, I totally agree, Michaela. That's how I got started in my public involvement work as well. I kind of just fell into this role and never left. So compared to the start of your journey in co-production, how do you think working with the public in this way has changed the way you ask questions to the public around data research?
It's definitely made me think a lot more about how I use terminology and how I approach that. So I now run everything through the filter of, if you can't explain what you're doing to a 5-year-old, you actually don't know what you're doing. So everything that I do, being able to make sure that it's written and spoken about in accessible language, that I'm not doing anything too convoluted, that I'm not using jargon, that everything can be super accessible, so that, you know, even from start to finish, if there's a moment where co-production kind of just ends up cropping up, well, everything's in place for it to just happen. I don't have to change anything about the way that we operate. So as a children's health and wellbeing researcher, a lot of it is from a rights-based approach. So through the United Nations Convention on the Rights of the Child. And within that, Article 12 says that all young people should be able to have a say on matters that affect them. So, you know, I think it's changed my approach in terms of making sure that at any point in my research journey, no matter what project I'm working on, a young person can step into the room and be an authentic part of that process, and that I don't have to sudden in place. So yeah, definitely having it as this like golden thread that weaves throughout everything that I do. So making sure it underpins, and that's then made it quite translatable into other projects that I work on. You know, being able to run it through the filter of like, yeah, okay, we need to make sure that everything is accessible. So yes.
That's great. Thank you, Michaela, for that. So I'm going to head to Georgina now. To find out a bit more about your experience of being involved in research projects. So thinking about your own experiences, can you share a moment where you felt your contribution really shaped the direction of a data research project, where you felt you had a voice in decision making?
Yeah, so one project that really stands out for me was called the Champion Project. And it was a meta-analysis, and I'll just do a quick sort of sum up of what that is in case anyone doesn't know. So we looked at a load of different studies that had already been done, and then we drew the conclusions from those studies together to find out sort of differences, similarities, things like that. And so Champion looked at children and young people with chronic pain. And we wanted to find out how best to help them. And right from the start, it was co-produced. So we actually helped co-produce all of the aims, which was really exciting because it meant that we led the direction of the entire study. So whereas initially they'd thought that the focus would probably be on a cure, we all actually said, no, we wouldn't look necessarily at a cure being the main thing, but at sort of treatment and managing, because a lot of us had conditions that we knew there was no cure for. So we're more looking for ways to manage that. And that sort of shaped the entire study and was really exciting. And the whole project was just full of moments like that.
Oh, wow, that sounds amazing. And I've only heard of a few projects where that happens, so that's great to hear. Um, and kind of related to this, as we know, data research can involve some quite technical lingo and can be pretty inaccessible if you're not regularly working in the space. Do you have any experience or examples of how researchers have engaged you in the more technical side of the data research and what made it more accessible to you?
So again, looking at the Champion project, it's a project really close to my heart and it lasted for 5 years. So there's a lot sort of to say on it. They really changed how the data related to us because at the time we were all children and young people. They needed to present it in a very sort of friendly way that was accessible to everyone. And so the first way they did that was they broke down the meta-analysis. Each study, they set a threshold for how much it answered a research question. And then we were given the ratings of poor, good, and excellent. And it was on things like how much they did the research question, but also sort of is it friendly to the UK? Is the culture similar there? So is the healthcare similar? And then we got to choose each threshold for whether we included studies that were poor, good, or excellent. And then they related all of the data back to us in cartoons, infographics, things like that, just to make it a lot more sort of appealing and a lot less data heavy.
That sounds amazing. Maybe we can share more about the Champion project after the webinar with attendees. So thank you, Georgina. I'm going to head to Akansha now. We heard from Georgina about how her contributions have helped to shape research. So I'd like to ask you something similar. From your perspective, how has co-production and working in partnership with the public shaped or guided your own research?
Yeah, so currently at ADRC&I, we're currently carrying out co-production across two projects involving individuals with lived experience of homelessness and care experienced young people. And quite frankly, co-production with these groups really shapes and guides our research at every stage. For those who don't know, typically data research tends to follow a specific cycle that starts from agenda setting, research question setting, data analysis, and then you write it all up and then disseminate. And so in our homelessness and mental health project, we actually partnered with a lived experience group to kind of advice across all of these stages. So, for example, when we were coming up with research questions, the group really highlighted their main priorities under the mental health umbrella, like addiction as a central concern, as well as domestic abuse and interpersonal violence. And this has honestly directly steered the analysis plans that we created across both of these studies. Now, of course, with data research, the data analysis stage is a bit harder to incorporate co-production in because of the 5 safes. So the data is typically held in a safe setting and it's harder to access unless you're a safe researcher. But what we do instead is we bring the results of the analysis back to the group and we interpret it together. And so what we did is we presented on the results of the analysis on the group's priority of addiction and homelessness. And having that lived experience insight on the interpretation is honestly so valuable because, as you know, the data can only show you patterns and not as much the meanings. So one example is that one of the findings that we brought to the group was that people who officially applied to the housing executive as full duty or legally recognized as homeless were more likely to be given prescriptions for alcohol or drug problems than those who were never recorded as homeless. And when we asked the group if they were surprised at how high the statistics were, the group actually told us they believe that the figures were lower and were low, and actually that the true rates are much higher. So they explained that some underreporting might be taking place, and that's a big issue. For instance, single mothers experiencing homelessness might avoid disclosure of addiction issues because they're afraid of child removal. And also, what was so helpful was that they explained the rates of addiction that we were seeing through the lens of their lived experience and things like chronic stress and trauma and self-medication. And so at our next workshop, we're actually going to be at the write-up stage. So we're going to have lived experience perspectives on how these results are going to be written up. And we're also going to be writing up and disseminating a lived experience version of a data insight together to really highlight the findings that the group thought were, the most important to communicate to policymakers, and also what the group thinks needs to change moving forward. And so honestly, these partnerships are so impactful to the research because it really does guide and shape, what we ask and what we analyze and how we interpret these results. And, it turns data, from a flat snapshot of numbers into a more contextualized story that's honestly truer to people's lives.
Thanks, Kensha. That's a really powerful example, and it's a really great example, especially to me because I've been hearing quite a lot like how do we involve the public in the data analysis and interpreting the data results. So thank you for sharing that. That's great. So next I'm going to head to Jack. So I'd like to hear about what's worked well for you in terms of fostering genuine co-production in data research. For example, were there certain tools or approaches that have worked well for you in the past?
In terms of a tool, I think just one that I'd always kind of shout out is as an acronym. It's the Public Involvement in Research Impact Toolkit, the PERIT Toolkit. Lots of people probably heard about it before. It's one of the kind of neatest ways I've seen of recording who you've spoken to, what was said, and what changes, if any, have happened as a consequence. And that's important for you for keeping a record, for your evaluation, your reporting, but it's also, I'm mentioning it because it's a tool for transparency as well, which is really important for co-production and feeling that what people have said or shared or suggested has been listened to. And what I've always tried to say is when you're doing co-production or you're doing public involvement, if you're taking feedback from people, you either have to adopt or explain. So either do it, or if you can't, if there's a genuine reason, you need to be able to explain why. Otherwise, that's where you get disillusionment. So that's a really good tool. In terms of approach, when you're actually working with people, you've got into that space. I go to sometimes things like this, and people say, and you're like, "How did you actually do it?" And so I've tried to think about things I've actually done. So like, I always try and do a kind of like, obviously, you need to do consensus building, power sharing. So when you're working with people, it's very much like a bottom-up approach. You're not saying, well, here's what we're going to do. So when you're trying to come up with ideas, I've done sort of little like tasks or workshops, like for example, there's a process called 1, 2, 4, all, where people, if you're trying to think of ideas for a solution, everybody takes 1 minute to think about it on their own, 2 minutes as a pair, then 4 minutes as two pairs, and you're beginning to share ideas, what are the similarities, what you build up, what you think is the best one together until the whole group's got one. Another one might be, which I did with some survivors of domestic abuse for sort of building up to a research project that you mentioned. We did something called minimum specifications, where the question was, what do you need to happen in order for us to work together in a way that's productive and empowering? So you had all of these different ideas, the usual kind of things you might expect around flexibility and being listened to and being championed and all of these different ideas. And then we simply, and it was all the do's and the don'ts. And then we said, okay, so could we work together if we ignored this one? Yes or no? And we worked through the entire list. So we got rid of the ones which maybe you could ignore if we worked together, but you were left with the absolute things you needed to follow. And that was a really good process at the beginning of research ideas or working with people. So you kind of have this, these are the ground rules that you've agreed on together then. So yeah, that's a couple of approaches that I've kind of used and stuff. And actually those, by the way, I got from I got from a website, I got from a tool, right? So it's called like the Liberating Structures menu. It's quite an old-fashioned looking website, but it's got some really nice ideas for workshop kind of tasks and things. So I'll stick the link in this after.
Amazing, thanks, Jack. I haven't heard of 1, 2, 4, 4 before, but I think I'm going to be using that at upcoming workshops. And I like the idea around minimum specs. in my own work, we always make sure that we have like a set of like ways of working, some set of ground rules that we can adhere to. For example, at HDR UK, we do have like code of conduct, which we instruct like give to our PAG and our PABs, public advisory groups, public advisory boards, just to outline like what things like respectful behavior, contributing to discussions, things like that. But I haven't heard about like cutting it down to those minimum specs, which sounds really interesting and something I'd like to explore in the future. So thanks, Jack. Some great tips there. Okay, Michaela, I'm going to head back to you for the next question. We heard from Jack about what works well when it comes to co-production, but now I'd like to ask you around the challenges. So what are some of the challenges you have faced in co-production and how did you tackle these?
So I think the biggest challenge, speaking from experience, is not getting the answers that you want, and how do you deal with that? So my biggest advice for anyone that is looking to start their co-production journey or is getting into it is to drop your ego. It's not about you. And sometimes that's really, really challenging. So from my experience, when I first took my role on in 2017, I was like the biggest sport advocate of all time. That had been a running theme throughout my life. I had done a sports degree. I played on sports teams. I genuinely thought that sport was the answer for everything. So when I obviously took my role, I was like, well, all young people are going to pick sport and this is the solution. And then immediately it became very apparent that young people did not want any form of structured sport. And that when we did this project with 1,000 teenagers in South Wales, what lots of young people wanted was unstructured fun and social activity with their friends, which to me was incredibly surprising. And leading a project that really bumps up against your values and what you believe to be true is really, really challenging. So I guess that is the biggest challenge, is like what happens when the people with lived experience tell you that your hypothesis or what you believe to be true is actually not the case, and being able to navigate that. But I think that's all around you being able to that power dynamic that I was mentioning earlier, like being able to say, well, I'm handing over complete power to you. I'm sharing this power dynamic with you, so I really want to hear. So yeah, like that I have to run things through the filter sometimes of like, this is not about you. So, you know, writing research or writing funding and things like that, just realizing that actually the reasons that you should be doing this is for the people that you want it to help, and not because you want an accolade or you want to be seen as this person. So yeah, that's definitely the biggest challenge, you know, challenging your own values. So yeah.
Yeah, definitely. And especially for those people who are working in like academic settings, universities, it's that struggle of balancing like the accolades, like you said, getting your name in like journals and things, but also challenging your own bias, like you said, and doing what's right for the people who your research is linked to. Um, and just on top of that, in data research, we know that projects can sometimes get quite technical and heavily focused on data infrastructure. I just want to know if you had any experience in this area and how you ensured that contributions from the public were taken seriously in these types of contexts.
My biggest thing would be that funders and people that sit on funding panels recognise that this is a legitimate way of working and this is the way that we should be working. What we're seeing at the moment, and again, this is from personal experience, but I think a lot of academics and people in research and people in this space are experiencing, is that, you know, we're seeing a lot of tick box exercises on funding applications now, where it's like, did you have PPI? Have you involved, like, have you done co-production? Where did it happen? But then when you try and embed that approach into the actual grant, lots of like reviewers and people are coming back with, well, this is just scary because you don't know what's going to happen. But if you authentically want to have that process in, you need to have funders that recognize that this is a legitimate way of working. And I've used this phrase like 20 times this week, but the definition of insanity is doing the same thing over and over again and expecting a different result. And that's what I kind of see at the moment in terms of research, is that we're doing similar interventions over and over again. We're doing kind of similar approaches to tackling some of the biggest public health problems. We're reiterating some of our, you know, how prolific some of the problems we have are. You know, we keep kind of taking that narrative around, you know, how, you know, we've got negative trends in certain areas. And for me, I'm like, well, the best way to tackle this is to ask the people that are, you know, experiencing this, take this to young people. If we have a physical and inactivity problem in young people, well, let's ask young people why. If they're not using their communities, let's ask people why. But until we have like funders recognizing that that is a legitimate response and that they're recognizing that in funding applications and it's not just a tick box, then yeah, that will continue to be a challenge, and that won't help us set up this infrastructure that we all desperately need to be able to do co-production really authentically.
Definitely, thanks, Michaela. And yeah, it's just that simple thing of ask the people who the research is about. Why is it so challenging? But that great response. Thanks, Michaela. So now we're going to head into the section where I'm going to ask you to share some advice and tips on co-production for our attendees and also myself. So I'm going to head to Georgina. What advice would you give to other members of the public? We have some in our audience who are thinking about getting involved in co-producing research. In particular, is there anything that helped you to feel confident and valued in your public involvement roles?
Yeah, so there's sort of two parts of that. So I would really find out, if you want to be involved, what do you contribute? What could you bring to the table and what are you passionate about? So I personally do health and social care research. I've got 26 medical diagnoses. I'm disabled. I've got a lot of things that I can bring to the table around all of the medical side of my life. And I'm really passionate about wanting to improve things for others in the future. And that's something you should sort of bear in mind, is some of these changes aren't going to come around for a very long time, but it's what you're doing could have a really big impact in the future to other people going through it. So, and that doesn't have to be healthcare, it can be people living in poverty. Maybe you're a parent and you've got certain views on things, maybe you have a specific job. There's so many different areas of PPI that you can join. And then as for what sort of helped me feel confident and valued, what I really love is when researchers say the phrase, "you are the experts." It's become sort of one of my favorites because you can be used to, especially if you're in like a marginalized group or things like that, you can be very used to being dismissed on certain things. I've been dismissed a lot in healthcare, and so to have that validation of, "Hi, we're here, we're listening, we're actually going to work with you." And that sort of equal partnership between us, I think, really makes a difference. Experience also helps a lot. Sort of the longer I've been doing it, the more confident I've become in myself and in my views. And then there's also doing sort of courses and things like that. So I did a psychology degree, but before I started my PPI journey, I did that separate to it, and it actually helped me learn about like ethics and other things like that. But there's loads of free online courses that you can do around different areas of PPI, so I definitely recommend sort of having a look online, seeing what you can get involved in, and then when you apply to PPI you can just put down that as that sort of added bit of experience, and it'll give you confidence. And then just have confidence in your own point of view. You know, you matter, your opinions matter, and your voice can really make a difference.
Great, thanks, Georgina. That's a great response. And yeah, as a public member who's getting involved in research, you are the experts in what you're talking about. You have that lived experience. It's the job of like the research team, the organization, to make sense of it in their context. So yeah, I really like that response. Thanks, Georgina.
Thank you.
And now, Jack, when it comes to public involvement and co-production, there is some misinformation out there, as well as an overwhelming amount of resources and guidance. So what's one thing you wish more researchers understood about working effectively with the public in co-production?
One's too difficult. I've got like three. One which is just super simple is that, like, I mean, I might be preaching to the converted here because a lot of people have said that they're working in this area, but it's doable. It's really doable. I get imposter syndrome working with data researchers because that's not my background. I'm astonished by their intelligence, and I'm so surprised when they feel imposter syndrome about doing PPI or co-production. It's not something you need to have the answer for. And actually, one of the most important parts of doing co-production is asking the people you work with what they need. Like, how do you want to work with us? What do you think will make you feel empowered to take part? So it's kind of a good thing to start from a point of knowing nothing. And it's super scary, but actually, yeah, convincing the people you work with, or if you yourself are doing it, to just get in touch. Like, you know, when I was working up ideas for the project that Katie mentioned, I know this is an issue people have, like, you maybe don't have funding to do PPI straight away. I was just getting in touch with specialist charities and saying like, "Hi, can I just have a chat about this idea?" Some of them had their own focus groups or their own forums. I was able to go along and have a word. So, yeah, I think that's a really important one. Another one, which is just a personal bugbear, if you're working with a small number of people in a PPR group or something like that, then I would see them as advocates for whoever they are representing, not representatives. It's a bit of a finicky thing, but if it was with data, you wouldn't use a small amount of statistical data to draw a big conclusion. Don't do the same thing with people. So, and don't put that pressure on them. They're just speaking for themselves. And lastly, I guess another wording thing is just like maybe just when you're planning what you're about to do, have a think about what you're actually kind of do in terms of definitions of co-production. So, what do I mean by that? When you're planning the research with people in partnership, then yeah, that's when research is co-designed. If you then go off and do it, the professionals go off and do it, then it's just that it's co-designed. If the research is planned by the professionals, but you co-deliver it with people, then that's great, it's co-delivery. I personally think that only when you've co-designed something with people and then you've also co-delivered it with people, it's co-production. It kind of needs to be that all the way through. So doing just co-design or just co-delivery, there's relevant reasons why you might do that in a particular context. There's still really good things to do. But when you're actually describing what you're about to do, what you have done, it's just something to think about. So yeah, that's my not so much one, my sort of my blurb.
No, love it. Thanks, Jack. And yeah, that final point kind of relates to what I said at the start. There's like an overwhelming amount of terms, and it's important to define what you're talking about, whether it's just like your public involvement just in general, or what do you mean by co-delivering, like what do you mean by co-production, just to make sure that the research team, the organization, the public you work with, we're all on the same page when we're talking about the same thing. Because these definitions do vary depending on organization, sector. So it's important to define those things from the start. And my final question before we head to the audience Q&A. So just a quick reminder to add your questions to the Q&A function on the toolbar. So this question is for Akansha. What advice would you give to researchers who are starting their own co-production journey in their data research projects? Are there any particular approaches or activities that have worked well for you?
Yeah, so I think firstly, just start where you are, even if it's small. At the end of the day, co-production is practical, hands-on work. It is something that you learn by doing, not just reading about. So when I first started, obviously as a researcher, I wanted to research how best to do this before I start. And so I read all the standards and all the guidance, which is definitely important to do before you start. But I don't think I actually really learned to do co-production until we actually started working together with the group and I actually learned and adapted with the group. And so there really is no perfect start. I think what matters the most is being open, being empathetic, and also just being willing to adapt. But yeah, another important piece of advice I think is prioritize relationships over outcomes. Co-production isn't just about producing a set of outputs for the research. It really is about how people work together. And at the end of the day, strong and trusting relationships really do create the foundation for collaboration. And without them, your outcomes might be rushed. And so take time to build trust, to build respect, and also to build capacity for data research, I think is important before jumping into tasks. Also be transparent. Be transparent about the limitations and be open to learning. I think being upfront with the group about what the data can and can't tell us and how that means that sometimes not all the ideas and questions the group have they won't always be answerable with the data. And so being transparent about these constraints and also the constraints in research, like timelines and data access, I think is so important because these things might be obvious to you, but they're not always obvious to everyone. And I think a really important piece of advice is celebrate success. So definitely recognize where the group's contributions have shaped or changed the research direction and make that visible through feedback. So for many projects involving seldom heard groups, this might be the first time lived experience voices have been meaningfully integrated into the research, and it is an important step that should be acknowledged. So it's important to highlight these successes to the group and really reinforce the value of the work that the group is doing. And this really could help also motivate continued engagement with the group.
I love it. Thanks, Akansha. That's a really nice point to end on there. Um, so I'm gonna go over to the audience Q&A now. So make sure to add your questions if you haven't already and upvote the ones you like. Okay. So first question is from Anonymous. What rewards and recognition do you offer? Long-term, high-quality work is understandably costly. So if you can't meet certain payment expectations every time, what other options do we have? And what do people want? Would anyone like to come in on that question around rewards and recognition? Georgina?
Yeah, so the NIHR recommendation is £25 per hour, including sort of any pre-reading, any work in between meetings, stuff like that. But that's not always possible. So it might be before the project's been funded, something like that. So it's really good if you have a PPI network to reach out to them and ask them sort of, are you willing and are you able to do this maybe without being paid, or are you able to take part in this project? We'd really like to name you on it, something like that, if it can't fully meet the sort of payment standards. And then the other thing that can be useful, especially for people on benefits, is things like voucher schemes and stuff like that is a really good way to do it and can often be sort of easier to pay through. But yeah, I mean, as for payment, it's really sort of finding people, if you do not have the funding, finding people who are willing and able to do it without the payment.
Thanks, Georgina. Good response. And just to say, in terms of rewards and recognition, specifically payment, sometimes that is a restriction of the organizations we work for, unfortunately. So we do, as researchers, organizations, we do have to work around them. Does anyone else have a response to that? Any innovative ways? Michaela?
Use the skills of you and your people around you. Like, so we've in the past been able to offer like training and workshops for people that have engaged with us. So we have done kind of like mindfulness for schools training courses so they can implement that in schools. And just being able to reach out, like, there are people around you that have certain skills. So like think outside the box. I think that's a little bit easier sometimes with children and young people because you can offer lots of really incredible opportunities. So that might be things like if you've got people that can offer sort of like free, they for their own time can offer opportunities to like do some courses in the school or being able to offer more play and things like that. So, being able to think outside the box and utilize you and your other people around. It's really good to talk, and you might find out that someone in your department actually is like circus skill trained, and then it turns out that like you can offer that as an incentive. So yeah, just like think outside the box, I think, and speak to people around you, because sometimes someone will surprise you and be like, oh, I can deliver something on that. And we've also done it with children and young people where we've recognised their participation with things like certificates and stuff like that, because then they feel like their time has been valued and that they've been a part of something. And we've also offered opportunities for young people to be on academic papers, to have their name on other kind of outputs as well, so that they can write that into their university applications and things like that. So it's wider recognition outside of just like a payment. But yes.
Love it. Thanks, Michaela. Do you actually work with someone who has circus skills?
No, I don't know where I thought
Oh,
that.
okay.
That just came out of my mind. But yeah, I've worked with people that can offer things like, skateboard coaching or just access to spaces and stuff like that. So yeah, I don't know where circus skills came from, but yeah.
Thanks, Michaela. Jack.
Only one really quick addition. Kind of following on from that, really, sometimes you or your organization might be able to offer something kind of like in kind, or at least offer something that's, it's one of those, I think, one of those principles of the UK stands for public involvement, mutual benefit, isn't it? And just as an example, there's a charity that I was working with where essentially they provided, sort of, I guess, access to their membership, and we'd done some conversations together. They'd supported our research application, and we were basically going to be doing co-production with them. And they in turn were kind of like, small charity saying, well, we've got a 30th anniversary coming up. Do you know any students who could help us do a video documentary about it? And I was like, no, I don't work with students, but I did do did a bit of legwork, asked around, and managed to get, in Swansea Uni where I work, the school or department of media communications. Turns out that is the thing they do. They have something where students can volunteer, and they've put them in touch, and they've advertised the opportunity, and they're going to have some help doing that. So it's not money, although we've now got the funding, we'll be able to do that going on, but it can lead to that's probably addressed somebody else's question about long-term relationships. When you work with each other for a long time, you can begin to kind of, I guess, find different ways where you can kind of look out for each other and promote each other's work and stuff like that. So just try and be as friendly and as helpful as possible.
That's great. Thanks, Jack. So I'm going to move on to one of our other questions. So you mentioned period and impact. Oh, I lost the question immediately. You mentioned period and impact, but how have you monitored and evaluated the impacts of your co-production approach slash process from different perspectives in data research? Any takers? Michaela?
I'll go. This is a really tricky question. So just think bog standard impact logs and being able to do like reflexive journals and diaries, I think are really, really helpful in this process. So you can just keep a log of like any sort of impact that you've had that might not fit within kind of the researchy kind of terminology, but it might be things like conversations that you've had, or like being able to dissemination events, being able to publish in non-academic journals or places, or being featured on podcasts, social media engagement, conversations you might have had with stakeholders, just being able to keep a log with that. And then also the other thing is like a reflexive kind of diary or a journal, just to keep track of your own personal, like the impact that the research has had on you. When we're working with young people, with not young people, but the public, I think that there's opportunities for you to really be impacted by what people are saying, and for that to really change your approach to your research, but also your work and your values and things like that. So being able to keep a reflexive kind of log of that, so that later on down the line you may have this lovely story to tell yourself, or it might feature in part of your work later on where you can reflect on that. But that's kind of like a different avenue, I guess, of approaching that.
Thanks, Michaela. Yeah, I just love recording all those interactions, all those different activities you do, just marking them down. So at the end of the project, you don't just have to do like a journal article, but there's such things like blogs, sharing your work through all the different ways that you mentioned, podcasts, things like that. Thanks, Michaela. Georgina.
I'm part of Cardiff University's PAR group, which is a public advisory group. And one of the things we always get sent afterwards is, so we always get like Menti questions during it. So on Mentimeter, sort of like scoring things, how well was your engagement in this, things like that. But we also get given like sheets to evaluate how we were included, how could we be more included. Like it covers absolutely everything of what could we be doing better and what are we doing well, which I really like. And quite a few groups that I'm involved in, like GPW, do that as well. And that's a really good way to keep track and keep like PPI at the center of it, is asking us what is it that we could do differently.
Thanks, Georgina. And just to double check, is GPW Genomic Partnership Wales?
Yes,
Yeah,
it is. Sorry.
great. Thank you. Akansha.
Yeah, and just to quickly add to that, really, I think when we think about impact, we think about the impact to the research, but also there is an impact being made to the group members as well. And that's what we're realizing as well in our co-production work. We're piloting a set of training capacity building data literacy tools. And so we also try to track how that kind of impacts the group's confidence with data and talking about data. And I think that's a really important aspect of impact as well. So we send in like Mentimeters before and after sessions to see if maybe confidence levels have improved, interest levels have improved, and things like that. And also feedback forms after to kind of see what the group wants to do and wants to learn next, and how we can kind of like incorporate that together to make, to create impact within kind of like the outcomes the group really wants to kind of prioritize as well.
Thanks, Akansha. Great responses. I hope that answered your question around impact and evaluation. So our next question, so someone said long-term and reiterative co-production relationships have been mentioned. What do your long-term relationships look like, and how long do you tend to work with people for? Jack?
I think the how long bit is a really interesting question. I think it's kind of as long as you've got that shared interest. I mean, you should, if you have that relationship with somebody already, then you're part of a shared community, a community of interest, a community of shared experience. It could be, but it's something that you're kind of passionate about, right? So, um, I think in terms of how that kind of looks, I mean, I gave the example just a minute ago about, I guess, kind of almost looking for opportunities for each other. But there's one charity who I've been working with for the last like year and a bit, year and a half, and they've been really closely involved in this one research project, which I've now got funding for, which is great. But there's three others that I've sat down with them and their members and talked through the ideas of, which were unsuccessful. And part of that is their willingness to and their enthusiasm to keep on plugging away and trying at different ideas, and but also, I guess, just being willing to, like I said, sort of show up and help them with stuff too. So they had like a sort of annual AGM for their charity and went along because actually, for you're getting something from them in terms of you need their experience, their knowledge, their support, but actually for them to be able to say for their funder, because charities obviously have quite precarious existences sometimes, and you're able to go along and be like, yes, oh my god, us from the university, we love these guys, they're so good, and actually you can do them a huge favor as well. So it's, I guess, treat it like a relationship and like your personal relationships, and try and just always keep making effort and keep talking to them, even if you haven't got anything useful to update on. Sometimes just see how things are. So.
Definitely, thanks, Jack. That mutual benefit there. Akansha.
Yeah. So I think the biggest thing with long-term relationships is kind of obviously making sure that the group still obviously wants to work with you, and also kind of like building on that relationship and taking it where the group wants to go. So in the past, at ADRCNI, we've offered lived experience internships for members that actually want to kind of be more involved in co-production, and then taking that relationship a little bit further. And also, of course, like life circumstances change, and a lot of the time sometimes group members might leave care, or might not be able to make these meetings anymore, and so new members have to come in, and so you don't necessarily want to lose those relationships with members in the past. And so what we've done is we ask the senior experts to kind of come in and talk about their experience of co-production. And so there is this really like nice line of like relationships that like are new, and then the ones that are older kind of keep being reintegrated. And so it's really just all about, I think, making sure that you're listening to the group and like taking that relationship building in the route that the group wants to take it, I guess.
Thanks, Kensha. I really love that example because we keep getting asked like how to sustain those relationships you've already built, for example, in PAGs, but you also want to introduce like new voices in, like how to do that. And that's a great example. I love that. Georgina.
Sort of echoing what's been said, I mean, I have relationships still with the people who I did my initial research project with 6.5 years ago. And I mean, I've known Michaela for sort of like 3-4 years. I've known Jack for about 3 years. And we've started sort of, you work together on one project and then it expands from there. The researchers go start other projects, and then you as a public member, you hope that they'll sort of come back to you and say, oh hey, I'm on this project, is it sort of in your wheelhouse, is it something you'd like to do? And so yeah, I always use the phrase like I'd like to be as involved as possible. So like if you have any research project come up that I can be involved in, send me an email. And I have some people who send emails maybe sort of once, like 4 times a year, and they'll say, here are some projects that we've got. Sorry if none of them are applicable to you, but we want to keep you like in the loop, which I think is a really great way of doing things.
I love that. Thanks, Georgina. So I hope that answered your question. And I'm going to move on to the next one, which is around co-producing materials for dissemination. So co-production is impactful in shaping research itself. To what extent do you also co-produce the dissemination of findings, and how do you approach dissemination for public engagement? Georgina.
I couldn't have put my hand up faster if I tried. Dissemination is something I'm a huge fan of as a public member. Like I love co-producing infographics. I've done podcasts. I've spoken at conferences. I mean, it's just sort of endless the things that you can do. And I think it's a really great time to sit down with your PPI and go, okay, where would you see this in the world that would impact you? So, an area I focus on a lot, especially for like accessibility for certain groups, is social media. So, get your PPI members to make things you can send out on social media and get your PPI members to maybe they're part of certain social media groups on like Facebook or something related to their condition, related to them being parents, something like that. And so you can really use their networks to share as well. I could probably talk on dissemination for about 10 minutes, but I'll keep it there.
Thanks, Georgina. Love it. Michaela.
I'm actually glad Georgina's hand flew up then because I was like, oh, Georgina's a really good person to speak to about it. I think the dissemination, co-producing dissemination plans is like a really exciting part of a project because you can get some very non-traditional outputs that you would never in your wildest dreams ever thought about doing. One thing that sticks in my mind all the time is there was an animation produced from the Champion project that Georgina's mentioned that every time I see it, I'm like, oh, this is really, really impactful. And that disseminates all the findings and the voices that were involved in that research. And I think that that's like such a powerful piece of work. But you know, it's like it's more around asking yourself, like, well, what do we want from that dissemination? Well, like, what's the overall goal? Do we want to reach people? Do we want to reach a non-academic audience? Because if that's the case, then as academics, we have to admit we're not best placed to do that. So then being able to reach out, I think, you know, Georgina mentioned social media. As someone that works with young people, this is like a real sticking point. So we as adults think we know social media. We absolutely have no idea what social media looks like for young people. So if the thing is to be able to connect with and disseminate outputs on social media, and you're doing research with children and young people and you want to reach them, you have to ask them, because you know, we're as adults, it's never going to work in a way that's going to access lots of people. One of my favorite examples of this, you know, working with children and young people and this happening is we had a young person's research advocacy group in a local school, and we were visiting them quite often, taking our kind of dissemination tools and our recruitment stuff as well, which is slightly different, but I think it is the same. It's like the story still applies here. But and someone came in and they were really proud of the recruitment materials and the dissemination stuff that they produced. They took it to a young person, and the young person was like, "You've used Comic Sans. This is disgusting," and was so open and brutally honest. And it was incredible because I was like, but this is exactly what can switch someone off, being able to engage with a project or being able to engage with the findings. So I think this is like, basically, long story short, this is one of the most exciting parts of doing co-production, and definitely utilize it as much as you possibly can, because what you think will work more often than not is going to have some resistance or is going to have some added value by asking people around you. So yes, definitely do it.
Thanks, Michaela. I'm loving the energy from you and Georgina here. Akansha.
Yeah, and just to quickly add to that, like ultimately, this is research about other people, and so it's important to ask and have, you know, the group's lived experience perspective on how the research should be framed and should be communicated. I think that's really important. So, actually, in an earlier project involving care experience young people, the group actually advised on how they wanted the research to be framed, and they wanted researchers to actually promote positive outcomes in the lives of care experienced youth, as opposed to, you know, the focus on negative outcomes that we see all the time. And of course, as researchers, sometimes unfortunately the negative outcomes have the most impact, and that's what we think, you know, we need to get out there. And it's really important to actually, you know, talk to people with lived experience and, you know, have their perspective on how they want research about themselves to be communicated. And I think that's an important piece of dissemination as well.
Definitely. Thanks, Akansha. That's a really great point to end on. We have unfortunately come to the end of this webinar. We do have a few more questions in the Q&A. So we will take these away and see if we can get some responses from members of the panel to share back with you all. But I want to say a huge thank you to our panel today. I've learned so much, and I hope you will have too. I just have a couple of slides around the feedback form. So I'll just share that now. So I think my colleague Anna has put a link in the chat to the feedback form, or you can scan this QR code. As it's our first year doing these PEDRI webinars, we're interested to hear what you liked, where we might need to improve, as well as your suggestions for future webinar topics, so what you'd like to hear about. So please add your thoughts to this form if you can. And finally, as we end all these webinars, we end it with the resource hub. So we're looking to improve our resources hub, which is found on our PEDRI website. We can put the links in the chat and also share these with you after. So we want to find out what you think of the resources that are on the hub, whether you'd like to add any of your own, and also to find out where you think there might be a gap in knowledge or in the resources in terms of public engagement in data research and statistics. So please feel free to reach out. Feel free to reach out to us. So thank you again to everyone for joining us, and we'll see you at the next one. So our next webinar is on the 9th of October, and it's all about effectively engaging minority ethnic communities in data research. And you can find out more about that on our website. Thank you everyone for attending, and thank you to our panel again, and enjoy the rest of your day.